Still live on JoyNews today. We'll bring you more stories on this coronavirus situation, and health facilities engaged in coronavirus preventive activities in Kumasi are calling for personal protective equipment for their frontline staff. Authorities say nose masks, clothing and sanitizers are in short supply amid pressure on internally generated funds due to unpaid national health insurance arrears. Medical Superintendent at Suntreso Government Hospital, Dr. Thomas Ejakupoku, told the Metro Health Committee on COVID-19 the hospital is unable to purchase more logistics until the insurance authority settles its indebtedness. The committee was on a tour to assess preparedness of health facilities to deal with any coronavirus updates. Love FM's Erastus Asaridonko has more.
The team's first stop was at the Konfanochi Teaching Hospital, where members and journalists were taken through the screening process set up by management. At Suntreso Government Hospital, the committee found management was operating what officials describe as a one-entry policy. All visitors to the facility were taken through compulsory screening and hand-washing process. However, frontline health staff told the team they lack the necessary protection.
Are available. The PPEs are readily available. I don't think that there will be any room for panic. But if they are inadequate, then there's a concern, because we have to protect ourselves and as well the patients that come into contact with us. So those are major concerns, that the basic logistics, the PPEs that we need, which will be provided for us. Yes.
Medical Superintendent Dr. Ajakupoku called on government to pay 3 months of NHIS arrears to enable them purchase protective gear.
Yes, there are a few things we can do here using our IGF, but for now, most of our men hold up the national health insurance. So we are pleading with the government, if because of this infection, government can pay us 3 months up to about July or August, then we can do something here with what we have.
At Menchia Hospital, the team lent sensitization programs and screening processes instituted by management have encouraged voluntary reporting of suspected cases. Dr. Kamaruddin Koku Hussein is the medical superintendent.
She was a 27-year-old lady. She's staying at Tafo. And then she claims that, she sells, I think, the hair, the one they braid. So she claims that some white people have been coming to her to buy the hair. And she was told that one of those ladies was coughing. And when she also started coughing, she thought she should come and be checked. And she was really coughing, and she had a pneumonia actually. Yeah, she had a pneumonia, so she was really coughing. So we suspected the pneumonia, but because the way she was insisting that she could be exposed, that we should check her for the virus, we had to, just as a precautionary measure, we had to isolate her and then check. That's what really happened. So we called our disease control officers. They came, took the sample, sent to KCCI, and it turned negative.
Mayor of Kumasi, Osei Esibe Entry, called for concerted efforts to fight the virus.
I will take this opportunity to advise all the private hospitals to get ready. And to the media, you should also come on board for us to step up the education, because the education is key. Now, I've gotten this slogan from Dr. Kwakun, that together we fight and together we win. So if we all come together and you sensitize the public to stay apart, keep the 2 meters away, use the sanitizers frequently, especially those who are counting money. After counting it, you need to use your sanitizer. So then you drink more water. If you drink more water, you wouldn't become dehydrated. So let us all follow the instructions that has been given us, and as a country, we will come out clean.
The team had enough time to visit the new Kumasi Central Market. Reporting for JoyNews, Erastus Asaridonko, Kumasi.